Hey, everybody. Welcome to this month's current patient webinar at Winona. I'm Angela, and I'm going to be moderating our chat today. I'm here with our one and only Dr. Cat Brown, and she is going to be leading the live Q&A, answering all of your questions, and I'm going to let her take it away.
Hi, everybody. I'm Dr. Cat Brown. I'm one of your Winona doctors. I'm located in the state of Pennsylvania. And I have been an OBGYN board certified since 2009. I actually was in the Army for quite some time. They paid for my education, and I served the United States Army to pay back that education, and have been dedicated to helping women of all ages. But now I'm focused on working as an OB hospitalist, primarily in person, and then also working for Winona to help our patients in the state of Pennsylvania and also in Florida with that menopausal transition and dealing with that change of life that so many of us are going through and have the challenge with. So I'm here to answer what questions you might have. If you have some burning questions that you haven't been able to answer, and we're here to talk to you about whatever is on your mind tonight so that we can help you learn a little bit more.
I think we have some people. I cannot see. I don't know if this happened last time where I can't see how many people are in the webinar. Can you see that there are people here?
Oh, no.
I
Well,
can't see anything. I mean, I can see our chat, but I can't see like how many people are coming in. So hopefully mine's just blank.
Gotcha.
Yeah. But yeah, I see someone's adding in some questions, and please feel free to, add them in. Because I know there's a lot of opportunity to get your questions answered since it's just us today, right? You're gonna have girl power times 10.
Yes.
That's
a
it.
close, intimate conversation. When else do you get a one-on-one with the doc that you can ask whatever you want, no holds barred, no question is off limits?
That is actually correct. Somebody was asking me today. We're doing an article about everybody's favorite topic, vaginal dryness, and so someone was asking me if Winona had an article where we discuss our product Blossom. And I thought, I don't know that we do, but then it was percolating on my mind, and I was at an appointment when this question came up, and the person that I was with was like, "Wait, what's Blossom?" And so then I had to tell her all about it. So it was sort of not the conversation you anticipate having in a public place, but I was like, well, since we're on the topic and everybody seems to be in the menopause age, I think we could talk about vaginal dryness, why you should use Blossom if that's your problem, etc. So it was an interesting, an unexpected chat while you're getting your hair done.
Oh, so in the salon.
Yeah.
Okay.
I mean, it happens sometimes, like, with friends where you're like at a coffee but like usually not while you're in a room full of people having chats about other things. And here we were. Yeah. So.
And in my experience, whenever that kind of happens, there's usually a lot of background noise, and as soon as the word vagina comes up, like everything hushes, and then everyone like listens.
What did
like, wait a minute, there's something juicy I might want to hear.
I'm just glad because it was like a day of appointments, so I was at the dentist earlier, and so I was like, better that it happened with the person at the hair versus the dentist. I was like, it feels a little less awkward.
Yes, I would agree with that one.
Where there's someone in your mouth and they're asking, so like, what do you do? Where do you work? And like, oh, so I was trying to make sure everybody was on schedule today for our webinar, and it was kind of funny to hear people go like, oh, what kind of webinar is it? Oh, well, I sit with our physicians and they answer questions about, So it was a funny and enlightening moment for everybody. Yeah.
Well, maybe while we collect some questions, we can talk about like vaginal dryness. Why does it happen? Why do we all of a sudden have to deal with that? So, I mean, really, the short answer is it's directly related to the loss of estrogen. Once we lose estrogen from our ovaries and we're not producing it as much, we lose that suppleness to the tissue in the vagina. So the estrogen is really what makes the vaginal tissue more elastic, more supple. It makes the skin of the vagina actually thicker. Also helps with our own natural lubrication. So when we start going through menopause and our estrogen is decreasing, that's one of the first places that a lot of women notice it. Sometimes they may notice the dryness and the lack of lubrication before they really start to have hot flashes or night sweats. And that's something that's very pathognomonic for us as a doc. When somebody says vaginal dryness, I know right away their estrogen level is plummeting, because that's one of the first things that we see. So often, giving estrogen cream locally, or even giving systemic estrogen in the form of body cream or even pills or patches can help that. And then the blossom works a little bit differently in that the blossom really helps with sexual arousal and orgasm. And what it does is that kind of works as a female Viagra, in that when we place the blossom, this product, on the clitoris, it helps blood rush to the area, which also helps those tissues to function more like they did in the past, and really to respond to your libido and your arousal better. And so often women that use the blossom really notice their orgasms are stronger, they're able to orgasm more easily, and their total experience of any kind of sexual activity increases. It gets better. Oh, I see a cat in the background already, Angela. I saw it go by.
There's an assortment of animals in my home, so 4
Nice.
exact. Yep.
Very nice.
Yeah, and I think
some questions that
we do
to collect. Okay, cool.
Are you ready?
I'm ready. Let's hit it.
Okay, so Michelle says, I took BioT HRT pellets and had some good luck, but stopped because it wasn't convenient to constantly get blood work and it was pricey. I don't have a uterus, so estrogen cream and DHEA was recommended. Are these similar to pellets?
Well, the nice thing is our HRT is a little bit different. Personally, I like it better because you're not having to go and get pellets injected every so often. So, the main difference is that you're having to go to a doctor's office and have the pellets placed. Depending on your physician doing that, you might have to do that every few months. Whereas with Winona, you can actually reach a doctor from the privacy of your own home. And then our HRT gets mailed directly to you. We have it in several forms: cream form, patch form, or oral form. So there is no invasive procedure to place it in order for you to get the benefit of the hormones. Other than that, the hormones are very similar to what's in the pellets. It's just that the way that it's being delivered is different, and it's a little bit more convenient for our patients.
Okay, let's see. Dawn says hi. Hello, Dawn.
Thanks hi, Dawn.
Carmen says she's having issues with feeling great and then having hot flashes, anxiety, joint pain, inflammation coming up. Each time her prescription comes up, she has to change it, and it takes a while to adjust again. And she just changed it to increase the estrogen, and now she's having hot flashes and poor sleep again. So it's not a question, but more of a statement.
Well, and so that sometimes can happen. I mean, what Carmen is describing is a phenomenon that can happen as it's not like one day we wake up and suddenly our ovaries just stop producing all our estrogen and we know exactly what dose you're going to need, and we just give you a dose and you stay with that forever. It can kind of be a gradual process. And also, our ovaries can sometimes continue to be making their own hormone, but it can be very much in a pulsatile way. So one day you might have a good ovary day where you have some good internal hormones that are being produced. And the next few days, maybe not so much. And it can fluctuate. And so that's why sometimes your dose can change and can fluctuate back and forth. So the closer we get into our menopause transition and the older we get, generally overall, when we look at the levels of estrogen, they might fluctuate up and down, but if you look at a graph, generally they decrease. So that's why sometimes the dose may need to be adjusted the longer that you're on HRT. It may not be, for the same dose that you start with may not be the same dose you might need 2 years from now or even 6 months from now. Every woman is unique. So it's best to really, look at your symptoms and adjust based on those.
Okay. So Martina says, or she has a question about Are there additional preventative tests that she needs to have done while on 3 presentations? She's not on Blossom. She's 50 and doesn't really have symptoms. She just wants to get ahead of her menopause symptoms.
Well, as far as preventative tests as a woman, I mean, really, when we think about preventative health and your overall health, as you're getting into this time frame in your life, it's important to make sure that your bone density is good. So often, at age 50, you get the lovely birthday present of starting to get screened for colorectal cancer, starting to get your bone density evaluated. So that would be with what we call a DEXA scan. You should stay on top of your women's health with doing a breast exam regularly, a pelvic exam, and pap smear. As far as preventative tests for menopause itself, I mean, blood work, a lot of physicians and a lot of providers out there will want to do blood work to see if you are indeed menopausal before they will offer you hormone replacement therapy, but it's really not necessary. The only time that the blood work is really helpful to us is after you've already completed menopause. We can look at your follicle stimulating hormone and say, yep, you're menopausal. It doesn't tell us like when it's most beneficial to start. Often it's most beneficial when you start to have symptoms. And every woman is different. Some of us have a horrific time going through menopause, and some of us have a more gentler transition. You really just have to listen to your own body and really, watch what your body is going through. Additional preventative tests for overall health, like you should get routine screening blood work just for your own health, like your cholesterol panel, checking maybe your thyroid as well. And often we'll check your blood count and a chemistry just to make sure your kidney and liver function and your blood count are good too. But for menopause, not necessarily.
Yeah. That's the sneaky one too, the bone density, because people forget about the bones. And I always say, I love that my gynecologist cares as much about my bones as I do, because you just don't realize till you have that bone density scan, like, oh, wow, my bones, these are the ones going to be with me forever. And if they're not in good shape, you're in trouble.
Yes.
Yeah.
We tend to kind of, follow footsteps of other women in our family. And so if you have other older aunts or your parents or grandparents, you think about older women that are very thin or maybe have that little the little hump. We call it the dowager hump, where they get like a little bend in the upper back. We know that as our bones weaken, and if we get osteopenia, we're at so much higher risk for having a fracture. Yeah. And it can be life-changing. I mean, after a woman has a fracture, she could lose her mobility significantly and lose her independence as we age. So it's definitely something you want to fight against.
Yeah.
We don't want to get there.
No old lady bones. As much as you can avoid it, no old lady bones. Okay. Dawn says her local OBGYN told her she needs to lower her dose as she ages, and that she feels great on the 0.1 milligram patch. Is it necessary to lower the dose after a while? She's 46 in surgical menopause, and she feels that she needs more estrogen, not less.
Really, there's no data out there that says that you need to lower the dose over time. So, our general rule of thumb as an OBGYN is the lowest dose that you need for the shortest duration that you need as far as safety of any medication, whether it be hormones or whether it be an antidepressant. So maybe your doctor is thinking that way. But if you feel good on the dose that you're on and you're doing well with it, there's no rule out there that says, you're only allowed to be on it for such and such a time, or that you have to start weaning down and decreasing the dose as you get older. Generally, most women are on HRT, about 5 years or so. And sometimes at that point, we'll have the discussion with patients as to when they want to try to go off of it. And we might do a trial off of it and see how you do. But especially when you go through surgical menopause, you have to think about what was the time that your body would have naturally gone through menopause, which for most women, it's 51, 52. So I really don't start that 5-year clock until after that age time frame for most patients. And it's a discussion that each of us should have uniquely with our physician. And there's no textbook that says all women should be off by this age or should only be on it for this duration.
Mm-hmm. Okay. Deborah says she's been experiencing an increase in hormonal acne on her face since starting HRT. She wonders if there's something she can do to eliminate it maybe adjusting her dose or another option to help mitigate that symptom.
Yeah. So, and the interesting thing is, it's like a trade-off that we have when we start hormone therapy. So, acne gets better as our hormones change and our hormones decrease. But then when we start giving hormones back in, you're bringing back that youthful quality of the skin, which also increases the oil gland production. And, the hair follicles are changing, and acne can become a real risk for a lot of patients. Often we see that more with the DHEA supplement than necessarily with estrogen itself. And normally this is something that's self-limited, meaning that it will happen, but it'll get better on its own. It's usually not something you have to continue fighting with. So rather than adjust the dose right away when you first start noticing this, I usually encourage patients to just try to change up their skincare routine. So often if you've transitioned to doing a more gentle cleanser with more anti-aging properties in it, it might be time to go back to like a hydrogen peroxide cleanser or a salicylic acid cleanser, just to reduce the bacterial load on the skin as your skin quality and texture is changing. Often you might just need to change what you're doing as far as cleansing and maybe even using a topical acne treatment temporarily while you get through this period of time, and then it'll get better.
Yep. I did that. It works. My face was out. It was so amazing that I was like, well, first I was angry, but then the second part was, I ended up getting they remind me of like those Stridex or Oxy pads you had in like high school when your face would break out, but now it's obviously a little more advanced and better products, but it has like retinol and different things in it. So, but there's one that I would use, and especially in the summer, because you're sweating, and then if you're sweating because of hormonal things, but then it's also hot weather, and I was breaking out, and I was like, oh, this is terrible. You feel like you're 14 years old. So yeah, it cleared it up. I mean, it took a minute, but it did get better. But I was kind of upset at first. I was like, wait, why is this happening right now? What's going on? When you're almost 50 years old, you think like, aren't we past the acne breakout thing? And then all of a sudden here it comes, right? So yeah, it does work. It's good advice, Dr. Kat. Really good advice.
And one of the products that is out there for over-the-counter use for acne is actually also has great anti-aging properties as well. It's actually something called Differin. It's adapalene gel, which is a vitamin A derivative, which is in the same family as retinols. So that one is actually pretty gentle. It doesn't have that same drying, capability that a lot of the over-the-counter acne medications have. So actually, it's funny. My son is 15, and so he's been going through a lot of acne the last couple of years, and I started borrowing his Differin, and I was like, at one point he was like, "Mommy, like, where is my tube?" And I'm like, I took it from your bathroom because I'm using it too.
That's awesome. I just put a link in the chat if you guys are interested in Differin.
Oh, perfect.
Yeah. It does work. I remember getting that before, but that's a nice thing that it's available now, because I think back in the day you had to have like a prescription now.
Yes, it was only prescription. When it first came out, but now a lot of things are over the counter that used to be prescription, so that's nice.
Yeah, for sure. Okay, who else? What else is on here? Libido. Okay. Michelle says her biggest issues are libido, that it's non-existent, and weight gain. And she doesn't really have hot flashes or night sweats. And reading all the comments in the Facebook group has made her terrified about gaining more weight. Will the estrogen cream and DHEA cause weight gain? She eats right most of the time and goes to the gym 3 to 4 days a week, and the weight is not budging, and she can't afford anything that's going to make it worse.
Yeah, I think the hard part is, when you're reading comments in a Facebook group or in a forum, you have to take into account that most of the time, the people that are most vocal about their experience are the ones that have had a really great experience and the ones who've had a really bad experience. The majority of our patients that kind of fall somewhere in the middle, you might not be hearing from as much. It's true that when you start HRT, you can have some fluid shifts and you can have some bloating and water retention, because the hormones can change the speed at which your digestion happens. And also we can have some water retention. So in general, I tell patients to stay away from the scale in the first week or two. Try not to really gauge if you're gaining weight, losing weight in those first couple weeks, because the first couple weeks is just about getting the medication started in your system and getting your body used to it. In general, most patients will actually lose weight the longer that they're on HRT, especially if a lot of your weight gain is hormonally related or stress related. Often if we are not sleeping well, if menopause has affected the sleep quality, or we're getting up with night sweats in the middle of the night, sometimes you're getting up to pee in the middle of the night and you don't even realize that it's actually a night sweat that woke you up. And then while you're awake, your brain then gets the signal, oh, yep, your bladder's kind of full, let's go pee. And so a lot of women complain about getting up to use the restroom multiple times. And then if you were to monitor them and put them on, monitors to see what their body is going through physiologically, often they're getting awakened by a night sweat, and then the peeing happens kind of secondarily. But as a result, our stress hormones are so high, our cortisol levels are so high, and we're in this kind of fight or flight mode. And so when we're in fight or flight, our body will not shed weight no matter how hard we work. You could work out 2 hours a day, for an hour at a time each day, do the most incredible cardio, do weightlifting, and maybe not lose any pounds if you're not sleeping and having that restorative sleep to really allow your body to kind of reset. So what the hormones do is really kind of help bring you back to that normal hormonal environment in your body, help with your sleep, help kind of reduce that stress hormone level so that ultimately your body can function at its peak. And so it doesn't happen overnight. So you can't expect that you're going to start HRT and the next day start losing weight right away. But generally, the longer that you're on HRT, you will start to see the weight loss that you seek. It will happen. So, and if you don't really have hot flashes and night sweats, necessarily early on, a lot of my patients will start just on the DHEA alone. And then as they start developing other symptoms, we can add in estrogen later on if need be. But every patient's unique. So you'll talk to your physician and come up with a plan uniquely for you.
Great. I also, for everyone who's on here, I just put in the chat a link to we have a downloadable menopause tracker, symptoms tracker. So if that's helpful to anybody who wants to track their symptoms, or you feel like you need a journal or a space aside from just maybe scribbling it in your notepad or Post-it or whatever, when you want to remember something you're experiencing, or if you're trying to track what's happening to your body, that's there for you. So check it out.
That's great.
I think so. I mean, I think actually, and I didn't check, but I think you can type in the PDF as opposed to like you have to print it out. Like, we don't want to kill trees, but you should be able to type within the PDF. If not, let us know. We would like to make it so that it's eco-friendly. Carmen would like to know, she says, what are the advantages or disadvantages to using either the patch, the cream, or oral estrogens? Does the cream give a consistent dose?
Well, so the real advantages or disadvantages is really what is going to fit into your lifestyle the best as a patient. What are you going to remember to take? Ultimately, when we use the transdermal or the skin methods rather than oral, the benefit is that you're bypassing your digestive tract. So you're bypassing having to take a medication that has to travel and get broken down by your stomach, then get metabolized by your liver before it gets into the bloodstream to get to the intended tissues. So when you place a medication on the skin, it's actually getting directly absorbed and getting into the bloodstream faster. So we can actually use a lower dose to be more effective than having, than a pill form in those cases. But, along the same lines, I have some patients where, they may already take a couple medications, and, adding a pill into their lifestyle is actually much better for them. It's easier for them to kind of fit into their day-to-day routine. So it's really what is best for you. I've had a lot of patients that prefer the pill compared to the cream, or compare the cream compared to the pill. It's really one of those things that's unique to each patient. And I always tell patients, my way of finding the right dose for you, it's kind of like trying on clothes. Every woman is unique. Every woman's different. Like, you can't take two women to the mall and find the same pair of jeans that they're both going to love. We all like a different cut, a different style. We all have our preferences for the way things fit. We might like them, fitted or tight, or we might like them loose. And same with medication. It's just about what is best for you uniquely. So, and the difference between the cream and the patch is that when we give you the cream, you're rubbing in the cream and the medication is getting absorbed as it's being rubbed into your skin. Whereas the patch is placed on and there's a medication embedded in the patch. So there's a more consistent, absorption of the dose of the medication over time with the patch rather than the all-at-once absorption with the cream. So just a little bit different, that way you can try what you think fits best into your life.
Great. We have a question about breast tenderness. This question asks, Sally says she's 4 weeks into her treatment and noticed this week she's developed tenderness in her nipple area. And will this pass?
Yes, this will pass. So, all of our tissues in our body as women have responses to estrogen and are biologically active to hormones. And so, hormones themselves, the breasts themselves actually can respond to the estrogen. And so that's what you're experiencing. So that the tissues are starting to get that estrogen on board, and sometimes the tenderness can happen as a result. Typically what we recommend is just to try to avoid like overstimulation to the area. So same as like when you have breast tenderness, when you would have your periods in the past, often if it gets really bothersome, you can take anti-inflammatories like Motrin or Advil, ibuprofen if need be, but this is a temporary phenomenon and it typically will get better on its own. If it does not get better after 2 to 3 months of treatment, then that might mean that the estrogen content might be a little bit high for you. So we might need to tweak the dose a little bit. But this early on, I wouldn't recommend changing your dose just yet. Just wait it out and it will get better.
Okay, I think we skipped. Michelle's letting us know that she asked, I guess, a 2-part question, and she wanted to know about the libido portion of her question. Like, what's the best thing that she should take for not having a libido?
Oh, gotcha. Oh yeah, we got to talking about weight gain and weight loss, and I totally, we went right into that. And sometimes I have a tendency to do that. I might go down a tangent or we might get talking. So thanks for bringing us back to your question, Michelle. So libido, for us as women, libido still has a pretty significant link to our own testosterone production in our body. So even though we're women, our estrogen, our ovaries produce estrogen and testosterone. And so when we're losing estrogen, we're also losing that inherent testosterone as well. So often when we start to notice that, it's just that we need to supplement with testosterone. Testosterone, however, is considered to be a controlled substance. And so it's not something that we can prescribe via telemedicine, like on a service like Winona. So the way that we get around that is by prescribing the DHEA. So DHEA is a precursor hormone, and what happens is when you ingest it, your body breaks it down into estrogen and testosterone. So it's a way for us to gently increase your testosterone levels without actually prescribing testosterone directly. And so that's the way we typically can help with libido. But along with those lines, I like to tell patients, and one of my things when we talk about like sexual function and libido for women, our largest sexual organ as women is our brain. Yes.
Yep.
Yes. So we're so much different biologically than men. Like men, you could look at and you can say, hey, you want to do it? You want to do it? Yep. And they can flick a switch and their brain and their penis can respond. We are very different. Like we sometimes have to have the setting just right. Our relationship has to be ideal. We have to have enough foreplay and romance. And honestly, like, you see jokes about porn for women, but often it's looking at people like doing housework, seeing a man in a vacuum or a woman doing cleaning. And it's like, yes, that's hot. But it's like knowing that your partner is doing something for you that they don't enjoy doing, but they're doing it just to make your life easier, sometimes is a turn on for our brains. And so often when you're having libido issues, sometimes I will also encourage patients to kind of look within in their relationship. Sometimes the longer that we're in a relationship with someone, we tend to want to be able to just kind of fast track and get right to the romance and the sex part. And we often forget the romancing and the whining and the dining and the effort we put into a relationship with our partner. Mm-hmm. And so that's something to revisit. There's a lot of good resources online. There's an app that was actually made by an OBGYN called Rosie, which is all about female sexuality. And they have like erotica available on there and, little quizzes and exercises you can do to try to help with that. There's another website called OMG Yes, which is also for patients. And it's all about female sexuality and female sexual function. But the DHEA is something that we could do immediately to kind of help as a supplement to help improve your testosterone and improve your libido. And also, I mean, just getting you better sleep, eating well, and getting restorative sleep goes a long way. And then as we also give HRT to help with your body's balance of estrogen in your system, your sexual organs will respond better. So think about like if your libido is kind of down and you also have vaginal dryness, and it's always like an ordeal to try to get sexually active with your partner, and you have vaginal dryness to deal with, and you have to get out the lube. It may not be so sexy anymore to have to like get all these things ready and have everything aligned before you're able to be intimate. If you can give estrogen supplementation and you naturally can get lubricated again, that can improve also your body's desire for sexual activity, because your body's going to respond more like it did when it was younger as well. So I think that HRT and the DHEA will help overall.
And I put those links to the sites you mentioned in the chat. So ladies, go check those out, because, resources are important. And everybody likes that. I guess, what's the next question? I feel like there was something I saw in here and I want to make sure we didn't skip it. Michelle, yes, she's been married 27 years and he thinks grabbing her boob should be a turn on. That's funny. I mean, funny.
Yeah.
Not funny, but yeah.
Yeah, you got to tell them the way that guys listen is sometimes with analogies. And when I was in the office still and seeing a lot of GYN patients, and couples would come in and talk to me about sex life and libido, when men would come in, I would tell them, okay, let me talk to you about this. Like, if you have a classic car, or you have that beautiful car in your garage that like you wax, you take care of, everything's perfect, would you ever just hop in that car and drive 100 miles? No, you're going to wax it. You're going to take it for a little drive around the block. You're going to take care of it. You're going to do all these things. Your wife's body is like a classic car. Like, honor it, care for it, get it prepared, make sure you do all those things before you want to take it for a spin. And they think, I don't know, guys somehow respond to car lingo.
Dr. Green loves to mention car analogies, right? So this is his point. He loves to talk about that. Yeah.
But yeah, so when you talk to men like that, they're like, oh. But yeah, they totally think that like just grabbing your butt or squeezing your boob is going to turn you on. And they don't realize, no, like, if you would just fake it, like you come down the stairs and you see your husband like pulling the vacuum out, doing something like that, or, taking you out or talking to you, just revisiting, like doing date nights again and trying to revisit the early parts of like when you were getting together. Like, those are the things that reinvigorate a love life and an intimacy, I think, between a couple. So much more work has to be done with that.
For sure. Okay, Marie says, she read in the Facebook group that some people are just purchasing DHEA over the counter. Is DHEA that we prescribe different from what's available over the counter?
Well, so the hard part is with the DHEA that's available over the counter, I don't know, we don't really know where it's being made, where the company is being made, and supplements are not regulated and modulated by like the Food and Drug Administration. Whereas what we get for our DHEA, I know our pharmacist has vetted and has ensured that the product that we want to give patients is actually what indeed we're ordering. And so for me, I trust the content of our DHEA more just because I know my pharmacist has vetted it. Whereas I don't know what you're getting on Amazon or at your local drugstore. You never really know when you look at those labels if what you're buying is actually what's in the bottle, and that's the downside to that.
Yeah, for sure. Okay, do we have other questions? Okay, anybody else have questions? We surely are not at the end of our questions. Sally's typing something. This is all helpful information, and thanks for speaking so candidly about this, Dr. Kat, because, I think people need to hear that, especially to talk to your, if you're someone who's with a man, that feels really relevant. Yeah, those conversations are important.
Yes.
Yeah.
I mean, I would hope that, if your partner is not a man and it's another woman who's in a similar situation, that they'd be much more empathetic to the situation, but maybe not. Every partnership is different.
'Tis
Um,
true. I mean, I
yeah,
don't know. I feel like women are more sensitive, and most of my partner, I mean, because I'm gay, so the people that I'm with are usually very sensitive. And sometimes it's like sometimes there's the other way where it's like too sensitive. And you're like, okay, we don't have to talk this much. Like,
yeah.
you can also move it along too. But that's okay. Yeah. So happy balance. Happy balance. Sally's just thanking us. Yeah, I think that I think these are all really good questions. Dr. Kat, are there other things you want to talk about while we're here? Since we don't have any questions in the queue at the moment.
I guess the other thing that we could talk about is just, how to know when you need HRT, or when should you seek care? And honestly, anytime you start noticing changes with your body and you start to notice symptoms that are becoming obtrusive to your day-to-day life and to your lifestyle, that's when you should start having the conversation. And Winona really exists for patients that maybe don't have a venue or a forum to be able to talk to their physicians about it. Or maybe you've mentioned something and you feel like they just don't have the time to talk to you about it, or they're not taking your complaint seriously. Or if, like most of America, you go to the doctor and you fill out a bunch of paperwork, you talk to their nurse a bunch, but then when the doctor comes in, you literally have 5 or 10 minutes and they are in, they're out, and then they move on to the next patient because they're in such a rush. You don't really feel like you have that personal opportunity to really get all your questions answered all the time, just because, with the way that our healthcare system is, everyone's trying to do more with less. Everyone's trying to squeeze in as many patients as they can. The nice thing is with Winona, like, you have the ability to ask your doctor questions whenever you want and on your schedule. So you type messages back and forth to your physician and they get back to you when they're able to, and usually within 24 hours. And you can ask anything on there. So, nothing is off limits.
Yep. Look out, they're going to start asking you for food recommendations. other things, anything goes, guys. No. Marie would like to know, Dr. Kat, do you know, or is there a way to tell when your estrogen level needs to be increased?
Well, so really, if you start, like if you were on HRT and you were doing very well, and then all of a sudden you start to notice maybe your hot flashes are creeping back, or your night sweats are creeping back, or you're starting to notice some of your original symptoms starting to rear their head again, that could mean that your body's own inherent estrogen is continuing to decrease and you might need to increase your dose. Or if you start HRT and you got some benefit against those symptoms and the symptoms are improving, but they're not the best that they could be. Like if you still feel like there's room for improvement, then that could mean that you might need to adjust your estrogen dose as well. Yeah.
Great. Okay. I don't think I skipped anything. I'm just scrolling back up here to make sure I didn't overlook anybody's questions.
So the interesting thing is I heard this little clicking happening, and my oldest son is on crutches right now, and it was him. So he's like standing behind me, like in the doorway, and he says, "Are you going to take me to my basketball game?" I totally forgot that he got hurt playing basketball last week. He twisted his ankle pretty bad, and so he's in a high boot and he's on crutches and has to be non-weight bearing for a while. But he wants to go to his basketball game and still support his team. So he's standing here waiting patiently for me to get off the webinar so I could take him. I know, right? So I'm wondering, could we pause briefly and I can run him over to the game? It's just down the street. And we could see if there's any additional questions that come up and I can pop back on. I mean, because we have the whole hour booked, right?
I mean, we can stop whenever we want. I mean, it goes 4:30 to 5:30, but we can stay on as long as you want to. So
okay,
that's fine.
Well, does anybody else have any questions they'd like me to address before I take care of my 15-year-old to take him to basketball?
That's so sweet.
We're real people with real lives.
Yeah, my niece just injured her knee at the end of her school year, and she wanted to be there for all of the end of the year sports games because she couldn't do anything. She had to have knee surgery, but she went to all the musical, her dance recital, the swim team. Like she had to sit on the sidelines, and she was like,
yeah. Absolutely. Yeah.
But
Like you still want to participate in Heart because like if he wasn't hurt, he'd be there playing tonight,
of
for
course,
sure.
of course. Yeah. Okay, well, good. I think everybody's
That's
saying that
great.
they had their questions answered, so thank you.
Well, and
And
just remember, we have these monthly. We have the current patient Q&A was tonight, but we also have for prospective patients as well. So if you have friends or anybody that you know in your life that's interested and that wants to learn more, you can encourage them to sign up for the webinar the early part of next month as well. And they can get their questions answered if they're interested in coming to Winona, we can answer their questions live as well.
that's right. And if you miss, well, you're here, but if you want to go back, not if you miss it, but if you want to revisit it, you can go to YouTube where all of our past webinars are there for current and prospective patients. We also will excerpt portions of this and put on social media. So just keep an eye out on our social channels over on YouTube and on Instagram, TikTok. We post stuff all the time. So if you want to hear the full webinar or any past webinars, go to YouTube. So check it out. Yeah. Well, thank you for being here and answering all the questions.
Sure. And thanks to everyone who dialed in and had some great questions tonight. So it's always good if you have good stuff to ask about because, I don't want to just randomly ramble on about stuff unless it's helpful to you.
Agreed. Well, thank you. And thanks to everybody again for showing up, and we'll see you guys again next month.
All right. Good night, everyone. Have a good one.
And good luck at the game.
Thank you. All right. Bye.